Good morning, everybody. This is the meeting of the Health and Wellbeing Board of Thursday, the 2nd of July 2020, and welcome all our Health and Wellbeing Board partners to this virtual meeting and the press and members of the public who are viewing the live stream of the meeting. I will now ask our Democratic Services Officer to set out the housekeeping arrangements for the meeting. So, Karen, can I pass to you, please?
Thank you, Chairman. Please note that this meeting of the board is being recorded by the Council for live broadcast and will be published on the Council website for a minimum of 6 months. In order to ensure the meeting is managed effectively, please could everyone present follow these ground rules for speaking. Only speak when invited to by the Chairman. If you can state your name before you speak if you've not been introduced by name. Some people may need to dial into the meeting and will therefore not have the benefit of the visual. Please can you mute your microphone when you're not talking. If you would like to speak, please type RTS, request to speak, in the instant message conversation panel on the left-hand side of your screen and click the arrow button to send. Please note this panel is visible to all parties. If you are able to, it may be helpful to indicate the particular issue you wish to speak on in order to try to maintain the flow of the meeting. If there are any recommendations moved that require a formal vote, this will be carried out either by the Chairman or myself, asking for a response of for or against or abstain from each member of the board. And finally, please can we ensure background noise is kept to a minimum as far as possible and mobile phones and other devices are turned off or switched to the silent setting for the duration of the meeting. Many thanks. Chairman, I'll hand back to you.
Thank you very much for that, Karen. I had to go and quickly turn my phone off just in case. Okay, that takes us on to agenda item 1, which is apologies for absence. Can I confirm if we have any apologies for this meeting?
Chairman, I can advise that we have received apologies from Debbie Fleming and from Eugene Yafale, and also I've just received apologies from David Richardson. Can I report and welcome Dawn Dawson, who's the Director of Nursing, who's attending on behalf of Eugene Yafale. I'm not aware of any other apologies, but if I've missed any, please say now and I can record those in the minutes.
Thank you for that, Karen. And can I just check, you've mentioned that Dawn Dawson is a substitute for Eugene Yafale. Do we have a substitute for Debbie Fleming or for David Richardson at all?
Unfortunately, we don't have substitutes for either of those members, Chairman.
Fine, but we are quorate because we do have sufficient numbers of board members that are from our partners in the health service.
Yes, Chairman, just to clarify for the record, the quorum is 10 members of the board, to include 2 councillors and 2 NHS reps, and I can clarify that we are quorate for the meeting.
Thank you for that. That takes us on to agenda item 3, which is declarations of interest. So can I ask whether any board members have any disclosable pecuniary interest or local interest in respect of the issues before the board today? In our papers, we do have a flow chart which explains what they might be. I'll just pause for anyone to declare anything. Okay, I'm not seeing any hands, haven't heard anything, so I will take that as there are no disclosable pecuniary interests or local interests to declare. Agenda item 4 is public issues. There are no public issues for this meeting. This meeting has been convened specifically for our agenda item 5, which is the BCP Local Outbreak Management Plan. All local authorities were required to produce a local outbreak management plan by the end of June. Our plan has been published and the purpose of this meeting is for us to have a presentation on that report and to formally approve the development of the local outbreak management plan with the Health and Wellbeing Board taking the role of the Local Outbreak Engagement Board, and to set up the subgroup that can meet at short notice should a local outbreak occur. So without further ado, I'm going to pass over to the Director of Public Health, Sam Crowe, to present the report, and then once he's done that, we can take any questions and discussion that's required around it. So Sam, can I pass over to you, please?
Thank you very much, Chair. Good morning, members of the board. I'm not sure my video's working, but I'm hoping that you can hear me through audio. The video may kick in. Before I move to introduce the report, I'd just like to provide some context about the current situation with COVID. Hopefully most of you will be aware that we're very lucky at the moment in the BCP Council area to be experiencing low numbers of cases. So the surveillance information that I get from Public Health England shows that we're seeing an average of around 1 case per day, and that's both from the Pillar 1 testing linked with hospital settings, but also Pillar 2 testing, which is how everybody else is tested via the national testing capability in the mobile testing units. So we are very fortunate that we're in this pattern of low numbers of cases. But we're entering very much a new phase now of the COVID pandemic, which is starting to think through how we can open up safely, how we can recover safely and live alongside COVID in our community. And I'm sure people will be very aware of the events that are going on in Leicester. And this brings the importance of local outbreak management plans even more sharply into focus. And the plan is really setting out how councils will work alongside Public Health England, health colleagues and other partners to identify and respond to increase in numbers of cases of COVID. We work to respond to information that we get from the new NHS Test and Trace service, which went live at the end of May. And in particular, it's our way of starting to set out how we take very, very clear actions in response to outbreaks in connection with particular high-risk settings. So in the first part of the pandemic, many of the high-risk settings that we were concerned about were hospitals and also care homes. That work will continue through the local outbreak management plan, but it also sets out our plans for responding and dealing with cases of COVID in other settings like schools, workplaces that are at particular higher risk. There's been a lot of coverage in the past couple of days about food processing factories. But also settings like supported housing and vulnerable groups who may find it more difficult to take some of the actions required of them if they test positive and are asked to self-isolate, for example. So I'd like to stress that a lot of the content within the longer plan that hopefully board members will have received is not really anything particularly new. It's building on work that we were already doing, working alongside Public Health England, councils and health service colleagues. The biggest change really in the plan is the role of the Public Engagement Board, which we're going to take a recommendation on shortly. So within the plans, the idea is that we will have an officer level COVID-19 Health Protection Board, and we have a health protection network which works across Dorset successfully for many years. That has public health people represented on it. It has infection prevention and control specialists, environmental health officers, a whole range of people who do the legwork, if you like, in connection with responding to outbreaks. That board has been formally stood up as our COVID-19 Health Protection Board and works across BCP Council and Dorset Council. But sitting above that board, at each top tier council is the requirement to have a public outbreak engagement board. What we're proposing today is that the Health and Wellbeing Board for BCP Council should fulfil that role, and the paper contains a recommendation today which we hope that you'll support, not only to approve the development of the local outbreak management plan, but also to approve the role of the Health and Wellbeing Board in fulfilling that function of public outbreak engagement. The initial thinking behind the development of outbreak management plans is that we need to be very, very clear with the public quickly if there's any change in our pattern of COVID cases. I think a lot of directors of public health would consider that enforcement should be very much the last tool in the box. And actually, what we may need to do is to be communicating with the public very quickly if we're seeing any change, any significant outbreaks on our patch. And that's where the role of the local outbreak engagement board is key. So we will communicate very, very clearly through that board with the public what we know, what actions we're taking, and what public health measures we would be asking our local public to take. It might be that we would have to stand that board up at short notice. So rather than falling in with the current timescales for the formal Health and Wellbeing Board, the paper also contains a recommendation that we approve the setup of a subgroup that could be called together at short notice. And we're recommending that as a minimum, that should include the BCP Council leader, Chief Executive, Director of Public Health and CCG clinical representative. In terms of the other elements of the outbreak plan, councils have been provided with a test and trace grant to support the development of our plans. BCP Council have been allocated 1.8 million to support the development of the plan. We're going through the process of developing our capacity plan and looking at how we use that resource very carefully, not only to beef up our capacity to respond, but also to consider what sort of support we might offer people who are asked to self-isolate, particularly if they're in employment where they may find it difficult to survive, for example, on statutory sick pay alone. So some of the work that we've seen supporting the people who are asked to shield at short notice through the Together We Can programme, we're in discussions with council colleagues to look at how we would extend that support, supported by the test and trace grants. The other themes that are being brought out within the plan that are going to be important in the next phase are surveillance for COVID. So we are signing data agreements with national government that mean that we can get much, much better and richer data at top tier council level. We're not only receiving data on Pillar 1 and Pillar 2 testing, but as I mentioned before, we're now getting data through from the NHS Test and Trace Service. That's the basis on which we continue to keep a close eye on whether there's any change in the pattern of our local cases. And we will continue to integrate that through the work of the EpiCell that was stood up under the Gold Command response when we were in the earlier phase of the pandemic. So both plans will continue to, we will share with the public rich data about the COVID situation, as we have been doing for the past few weeks. And if there's any change, I'd just like to assure board members that very quickly we will be involving the Health and Wellbeing Board as described and setting out very clearly what we need to communicate by when. So I'm happy to pause there and take questions and perhaps open out the discussion. We've published the public-facing summary on the BCP Council website. That went live on the 30th of June. I was just going to say that the longer plan has a lot of detail within it, and as we start to work through with the Health Protection Board exactly what the action cards that are coming out nationally require of us, all of that detail will be developed and published on the website as an online toolkit. There'll also be clear communications protocols developed in support of the plan. So there's still work to do in connection with that plan. But perhaps I'll pause there and take some questions, Chair, if that's okay.
Thank you for that, Sam. Tim, you wanted to come in. Tim Goodson.
Yeah, I mean, clearly it's an important piece of work, this, that, as Sam said, represents a point in time, really, and there's bound to be an evolutionary sort of stage to this as it continues to develop. But I'd just like to say, you know, having read the more detailed version of that, you know, it is a pretty comprehensive piece of work there, and it pulls together from all the sort of the partner agencies to get to it. So just really sort of, you know, well done to those people that have pulled it together to be able to do that. And, you know, we're trying to offer all the support we can to actually make this work, and, you know, really happy to sort of fully endorse it.
Thank you for that, Tim. Can I just get some clarification, Sam, before I bring Jan Thurgood in? One of the things which I think many members of the public, and certainly I've shared with you and with others, is what additional powers might come through to local agencies in the event of this. And that, I think, has been a source of some frustration, certainly thinking about our partners in the police and other agencies over, you know, where do the powers lie? Where is the enforcement? Or is this much more about encouragement? And how do we make it really clear to the public who is responsible for what? Because I think that's caused a lot of problems for all the agencies in public expectation. So can you make some comment on that before we bring Jan in?
Yes, thank you, Chair. So I think within our plan, we're thinking of this working at 3 levels. And as I described earlier, much of the work we would regard as sort of business as usual response to contained outbreaks in particular settings. And we already have powers to work with any premise where we suspect that there is a communicable disease issue, work with that premise to close it if necessary, working with Health and Safety Executive and other legislation that's already in place. I guess the second level is when we're starting to see perhaps COVID cases and outbreaks that are more complex, and if they are likely to have a consequence, which means that we are starting to exceed our ability to respond and cope within our sort of standard set of resources, that's the sort of situation where we might be starting to say we need a bit more of a multi-agency response here, and we would escalate that very quickly. And the third level is perhaps what's happening in Leicester, where you're starting to see community transmission which has implications at a national scale. So there's this sense of local outbreak management plans being the sort of front line, if you like, of how we contain COVID in a local area and prevent the need to go back into the sort of situation that we've just come out of, which has required a national lockdown. So what's happened at the moment in Leicester is that they're having to look at statutory instruments very quickly to support the sorts of powers that they've brought to bear on that local area. So they've closed schools, they've advised people, you know, not to travel, or for essential travel only in and out of Leicester. There isn't really a sort of local framework whereby we can do that clearly, but they are looking at this nationally, and I believe that this will be considered by Cabinet in July. So I'd expect further detail to come out in support of local outbreak plans. My sense is that, as I said in the introduction, if we have to move towards a situation of enforcement, that should really be the last resort. And actually, the real strength of these plans is, I think, the fact that councils have been asked to lead it, the role of the Public Engagement Board and having the council leader very visible on that alongside other key members. That's really important in being able to be transparent with people about our local situation, what we know, the actions that we're taking quickly. And I'd hope that through that board, we'd be able to educate and inform and sort of work with the public in that way rather than looking at enforcement. But obviously, if we do have a difficult situation, it comes to requiring different powers. That is being looked at. So I'm confident we'll have more detail soon.
Thank you for that, Sam. Jan, Thurgood.
Thank you, Leader. I'm Jan Thurgood and I'm the Corporate Director for Adult Social Care for BCP Council. We've just been holding a meeting on safeguarding across the Council, Dorset Clinical Commissioning Group and Dorset Police, which we put in place as a fortnightly meeting chaired by the Chief Executive of the Council to look at all issues related to safeguarding through the COVID-19 period. From that meeting, we just wanted to say that probably we should add into the outbreak management plan a reference to safeguarding and ensuring that we take into account safeguarding issues if we have to when we're enacting the work of the outbreak management plan, and note that we do have a safeguarding current safeguarding meeting that could be a reference point if we want discussion on that. Thank you.
Thank you, Jan. Lesley, Councillor Dedman.
Yes, thanks, Chairman. Can I just say this is a terrifically huge and detailed report, and I just wanted to mention what Sam actually touched on, which is how how actions have to be communicated and cascaded down to the population, which I think is one of the problems that we've had so often. And I note on section 4 in the big report, we're saying, and I think it says here, engagement of local communities through the elected members from the Health and Wellbeing Board. And I just want to note that sometimes this is quite difficult, as I think many of the councillors know, to actually engage the elected members sufficiently for them to engage the community. And I just want to sort of note that to all of us here who are elected members, that that we will need to do that in the case of an outbreak. And the other point I want to make, Chairman, if I can, is just that when the board is in operation, if in God forbid there is an outbreak, it does say that we will co-opt other key representatives when needed in the context of an outbreak in a setting such as schools, housing, care homes. And I'm really glad that that is in there, because so often we are telling people how to do it rather than them advising us on these boards. So really 2 notes, and the other thing is to say I really think it's a very good report, so thanks very much, Sam.
So Sam, just coming back on that specific point about co-opting other people, would that would be done through the protection board that you reference in the governance?
Yes, I think in terms of the sort of technical response of what we do, if we do have an outbreak in a particular setting, we would co-opt relevant officers that have frontline experience. And sometimes it's not just about the public health action, it's thinking through, I guess, from different angles, what might be some of the consequences, what we can and can't do, and particularly comms and how we sort of communicate clearly in a way that makes most sense for that setting. I guess the question for the way that we start to operate as a public outbreak engagement board is we've talked about standing up a smaller group very, very quickly if we needed to do some comms in response to an urgent issue on our local patch. And I think the same principle probably applies, doesn't it? Councillor Dedman made the very important point that obviously if it affects a smaller area within BCP Council, we would have to involve the ward member. So I think we would have those discussions very quickly about what would be the appropriate membership at which level and for which board.
Thank you for that, Sam. Seth.
Thank you, Chair. Question for Sam. Actually, I've got 3 questions. I'm sorry, I'm going to be cheeky and squeeze 3 in. Sam, first question, could Sam confirm that the emergency services are identified as a specific complex setting within the local outbreak management plan?
Thanks, Seth. I don't believe that we've identified emergency services as settings specifically, but more than happy to take that through the COVID-19 Health Protection Board. And particularly, I know we've had conversations with different services about some of the implications of the NHS Test and Trace service and what the requirement to self-isolate might mean for services. But certainly, if there are particular questions or issues, the COVID-19 Health Protection Board is the place to work through that. So I'd be very happy to hear about those, Seth.
Okay, thank you. Obviously, the fire service are working across 4 health and wellbeing boards, and we're just looking to pick up and work with all partners to make sure we try and get some consistency or find out how boards are operating. So thanks, Sam. The second question was, so you kind of touched on it there, what arrangements are in place to ensure all emergency service worker contacts in work are subject to T1 tracing? And I just refer that point one we were talking around, the specific complex setting is already in place in Wiltshire and Swindon, but the second question is, I think is still unclear across the region in the UK yet.
So Seth, could I just clarify your question? So Tier 1 contact tracing is contacts in complex settings. What are you asking about that's not in place yet across the country?
So that's around what arrangements are in place to ensure all emergency service worker contacts in work are subject to T1 tracing. I understand that's still being developed.
I can take that outside of the board because I'm not entirely clear. What I would hope is that for the NHS Test and Trace service, the way that it's supposed to work is that through those interviews, anything that resembles a more complicated case with contacts should be automatically bounced up through the tiers. So anyone who's had connection with emergency services or complex settings should be handled by that tier 1 contact tracing, which is carried out by the regional health protection teams. But I can take the question back and we can double check for you. That's helpful.
Brilliant. Thank you, Sam. The last one, and you may not have an answer, is do you know when the action card will be available for partners?
So we've seen drafts of the action cards already. I need to check the sort of formal national publication dates. My view is that they probably won't change very much. It's actually about how we bring our actions to life within our local plan that's really important. So we're already starting to schedule time within the COVID-19 Health Protection Board to identify the best officers to work through those action cards. So that's being timetabled already. We're starting to prioritise those and work through them in a sort of risk-based approach. If you would like members of your service to be involved in working through some of those implications for emergency services personnel, that would be great.
Yeah, we'd be happy to support on that. Thank you, Sam. Thank you, Chair.
Thank you, Seth. Councillor Moore, please.
Yeah, thank you, Leader. Clearly a huge amount of work has gone into producing this plan, so thank you for that. Can I ask Sam a question on the antibody testing? There's comments on page 11 of the big report, and it says that the results of this testing is currently not clinically or practically important, as it's not known whether the antibody response is protective, and if so, for how long the immunity lasts for. Can I sort of assume that, am I right in thinking that you're doing this now, but it's not for the current situation, it's for sort of the future situation? Or why are you doing it, basically? Thank you.
Yes, thank you. So that's correct. It's very much trying to understand the sort of pattern of spread of COVID. So who's been exposed over the past few weeks as we've gone through that sort of first wave. Public Health England and scientists involved in antibody testing are being extremely cautious about what it can and can't tell you. And we would very much not want people to get the idea that if you've had an antibody test and it shows that you have COVID antibodies, that doesn't necessarily mean that you have immunity. So people connected with that pillar of testing are being very, very cautious about how it's used. We are learning more and more about what happened over the past few weeks and months, and that antibody surveillance programme is an important part of that jigsaw.
Thank you for that, Sam. Sandra, are you happy?
Yes. Yeah, thank you.
Just a clarification, Sam, around the number of PCNs, primary care networks in the BCP Council footprints. I think Sally Sancroft is going to clarify that. There may be a factual alteration on that. Does anyone else wish to speak on this? It's been such a huge piece of work that Sam and his team have actually done. Oh, Kate, you would like to speak. Kate Ryan.
Hello, thank you, Chair. Just from a housing perspective, I wanted to flag up. I appreciate that Sam Crowe said it's an evolving document. I think that from our reflection, there's a few more high-risk categories, including sheltered housing, that I know we have managed to get that reflected, I think, in the summary, but just would welcome the opportunity to carry on really working with public health colleagues to unpack both in terms of council provision, but also that provided by housing associations and other partners to make sure that we get that joined up approach in terms of thinking through those wider high risk settings in terms of housing.
Great, thank you, Kate. I know that Rachel Partridge has been having good conversations with her own meetings, so again it's another good example of what we need to work through the COVID-19 Health Protection Board, just to make sure that we're drawing on all of the resources and the knowledge about the highest risk settings on our patch. Thank you.
Can I ask a quick question, Sam, around transport? Because I've read the paper through several times, and I'm not sure that I saw an awful lot about the potential implications on cessation of public transport or closure of the airport. I'm not sure if the airport has reopened, but whether it extends, because obviously we don't have any transport representatives on the Health and Wellbeing Board, and I wondered what their partnership involvement might be.
Thank you, Chair. There is a Ports and Borders group which has been meeting locally, and I believe that representatives from that group will be on the COVID-19 Health Protection Board. So at officer level, we've got connections into that group.
Okay, and that would include local public transport rather than just border?
I don't know whether local public transport providers are represented, but we can pick that up and we can make sure that we can join that up as the plan develops. Thank you, Sam.
Graham Farrant, please.
Thanks, Leader. I think I just really wanted to echo some of the comments about the amount of work and particularly that's gone into this, and particularly the short time scale. Government sort of announced the need for this. It was a very tight time scale to produce it. We had to publish on by Tuesday evening. So from Health and Wellbeing Board's point of view, we couldn't meet quickly enough to get it agreed before it went out. But hopefully colleagues will agree it's a good document. We did have an informal challenge. There's a network of national coordinators of local outbreak management plans that are challenging each council. We had the South West representative actually with some quite fulsome praise of the amount of detail that had gone into our plan and the amount of work that had gone into it. Having said that, of course, it's just worth emphasising that this will be an evolving document. It will continue to develop. We'll think of new aspects. When some of those cards come out giving details of situations, we'll think, oh, actually, there's an issue here to raise to pick up in the local outbreak management plan. So agreement through Health and Wellbeing Board today is important, but also it's important that we recognise that the document will develop over time. And things like the transport operator contact, that's a really good suggestion that we need to make sure that is built in. And then I think we'll come up with new ideas as we go through this and as we develop certain situations. So I just wanted to emphasise, A, the amount of work that's gone into it, the speed of response, which was exceptionally good, and then the fact that it will continue to evolve.
Thank you for that, Graham. I'm not seeing anybody else with a request to speak. I think obviously, as Seth has already expressed, the action cards are going to be just as important as this report, and then they're going to be very heavily involved with the partners on making sure that we're ready. Hopefully we'll never need this local outbreak plan, but it's always much more important to have it ready. So I'm filling for a time. Oh, yeah, James, did you want to speak? Yes, James, do you want to come in here, James Vaughan?
Chair, I wonder whether it was just helpful for the board to be reassured that the Local Resilience Forum have been running a strategic coordinating group for COVID-19 for the last 14 weeks. People like Sam and Graham and I and others have been meeting 3 times a week for the first 3 months and now twice a week. So the all senior leaders in all partnerships across the BCP area and the Dorset Council are engaged. This plan is been subject to some scrutiny on the SCG. We all agree it's a really fantastic piece of work, and it enables us actually moving forward to transit from the SCG response phase, moving into longer term recovery, chaired by John Selgren, and that transition is planned for towards the end of July. But the quality of this plan enables us to be able to have very, very fixed criteria about at what point we stand the SCG back up, so that you and others can be reassured that in the event of an outbreak, the partners will come back to the table very rapidly in the strategic space. So I'd just like to commend Sam for the great work, and it doesn't mean that we're not going to continue as an LRF to focus on COVID over the next few months. Thank you.
Thank you for that, James. So can I pass back, Sam, to you just to sum up before we clarify whether we need to formally vote on this? Thanks, Sam.
Thank you, Chair, and thank you to board members for your comments. And it was a very, very quick piece of work, and I'm very, very open if we've missed things, if we've not quite got the right tone, if you don't feel that the actions are capturing what we need to do widely enough, please do feedback. It is, as Graham said, it's going to be a live document and it's going to evolve as we develop that. I'd also I'd endorse what James has just said as well. This is it's the key way that we are going to transition now into living with COVID and continuing to recover safely, continuing to help our businesses and communities to get back to a new normal. I am still very, very vigilant, and I do check regularly for any change in our pattern of cases. And I'd just like to continue to assure board members that if there is any change, we now have very, very good relationships locally whereby we could escalate anything very quickly. This paper and this outbreak plan sets that transparent framework by which we do that, but it's only as good as our continued efforts to exercise what we need to do. So that will evolve. We will start to publish a lot more detail on the action plans. The Health Protection Board is meeting weekly to start to work through and grapple with what that means for different settings. I'm really pleased to take on board some of those comments about things that we haven't yet thought of within the plan. And I just ask board members to, again, if we haven't covered anything sufficiently, we're very, very open to taking that on board and working through it with the Health Protection Board. So I'd just like to finish by thanking everyone for their support in connection with this piece of work. We're going to continue to need your input. It's only as good as the people that are putting time and effort into making that plan ready to go as a live working plan. But thank you for your time today, and I hope that you support the recommendation.
Thank you for that, Sam. That's great. So we have two recommendations before us, which is that we approve the development of the local outbreak management plan with the BCP Council Health and Wellbeing Board taking the role of the local COVID-19 outbreak engagement board. And we approve the setup of a subgroup to be called at short notice, and that will include as a minimum myself as BCP Council Leader, Graham Farrant as Chief Exec, the Director of Public Health, Sam Crowe, and a CCG clinical representative as a minimum. So what we've been doing in terms of voting is that if there is any dissent or anyone that wishes to vote against it, we ask them to speak now, please. I am seeing no request to speak, no dissent and no comments. Is anyone wishing to abstain? Again, deafened by the silence. So I'm going to take that as assent from everybody that we have approved that item. And as I say, this is the single item on this meeting of the Health and Wellbeing Board. So I'd like to thank everybody for their time and attention, and thank you, Sam, for the fantastic work that you and your whole team have put in to make sure that this happened on time. And I hope that it's a piece of work that's completely wasted, which we don't say very often, but let's hope it just gathers dust on a shelf somewhere. And at that point at 10:40, I will close the meeting. Thank you very much.